Hello, my name is Dr. Jonathan Keeve. I'm an orthopedic surgeon at Northwest Orthopedic Specialists. We are affiliated with Columbia Medical Associates to form the Northwest Sports Network. My training began in New Hampshire at Dartmouth Medical School, and then I did my residency at the University of Utah in Salt Lake City, fellowships afterwards in Seattle and also in Switzerland and Germany. And I've been in Spokane for 28 years and treating our local athletic population for the entire time. We don't really have a typical patient. We tend to see active patients with a variety of problems, ranging from children with broken arms to elderly people that have arthritis in their hips or their knees. And we try to take care of everyone as best we possibly can. The ideal patient is someone who's motivated to get back to the activities that they enjoy. Oftentimes those are sporting activities, and those people can be in all age groups. We have the luxury of having lots of very well-trained physicians and surgeons in our group, and we're able to offer a wide array of treatments for all sorts of different problems, ranging from acute traumatic problems to degenerative problems. We have a large brain trust with a lot of people that know a lot of things about a lot of different things, and we're able to apply all of those skills to our patients. My exposure to orthopedics began just before medical school when I was riding my bicycle across the country and became a patient for the very first time in my life. So I spent a year on crutches and a long time recovering from my injuries, and I decided at that point that I wanted to be the guy to help people recover from their injuries. And I've tried to apply what I learned as a patient to my own treatment of patients in terms of reconstruction techniques that they may need, or treatment of injuries. And I guess it's whatever you need to get back on the bike, which is what I did. And I continue to ride bicycles long distances and a variety of other sports. So it all sort of works together. I think it's helpful to be a patient, although maybe a rough way to start medical school. One of the things that's really helpful for us is to take care of patients who are engaged in helping themselves get better. And I don't think there's a more motivated group of athletes than perhaps triathletes and other endurance athletes. They're the kind of patients that really want to get better and want to get better quickly. And we try to facilitate that as best we can with physical therapy, with state-of-the-art treatments. And these are all tailored to whatever the individual patient or athlete might need. Most of us are also endurance athletes, and so we can relate a lot to what patients might need, and triathletes have sort of special needs, and we try to cater to that as well. I think one of the important things about being a physician or a healthcare provider is you try to provide good access to everybody who needs it. And since Spokane is geographically sort of dispersed, there are lots of athletes in these smaller towns that don't really have access to state-of-the-art healthcare, and we're trying to close that gap with outreach programs to address their needs. If you play football in some small school somewhere in the wheat fields, you might not get the same treatment as you get if you live on the South Hill. And we're trying to close that gap so all students, all athletes have access to what they might need for their care. We've treated all sorts of age groups, but one of the gratifying things is seeing someone that you took care of 20 years ago that came back, and since you saw them, they have healed up their fractured tibia or their injured knee, and they've spent 6 years in the military, and now they have a couple of kids, and now you're taking care of their kids who may have the same injuries. And that's gratifying to sort of see multi-generations of athletes. And it's kind of heartwarming to know that their dad had the same injury 20 years ago, and they can also recover from that.